Good afternoon. Let's get started, Mrs. Smith. I am Ms. Van Snooten. I am your son's teacher and I'm very busy. I am convinced that your son Billy has a disorder called Attention Deficit Hyperactivity Disorder, also known as ADHD. I know, because I am a teacher.
I know what ADHD is. How do you know my son has this condition?
He's disruptive in class and he talks out of turn. He needs a Ritalin prescription.
I was actually asking what sort of qualifications you have to arrive at such a serious and life-altering conclusion.
Oh, that. Well, that's simple. I'm a teacher.
Seriously? If you say so. How is he disruptive?
He has a difficult time remaining in his seat. He's always fidgeting. Billy has ADHD. He needs Ritalin.
It's not uncommon for 6-year-old children to find it difficult to sit still for long periods. What does he say when he talks out of turn?
He complains that he's tired and hungry. He's distracted. If he were taking Ritalin, he wouldn't notice that he was tired and hungry.
How often do you allow your students to have breaks?
Teachers are very busy. We don't have time to give the students breaks.
What about recess?
Teachers are very busy. There's no time for recess. Billy has ADHD. He needs Ritalin.
Do you mean to tell me that students don't get a recess period?
No. Teachers are very busy.
What about snack breaks?
Teachers are very busy. There's no time for snack.
How many times a week do the students have PE class?
There's not enough money in the budget for PE class and there's not enough time.
So you're telling me that these children are expected to work all day without a break? And you're telling me that the students don't even get the opportunity to burn off stress and pent-up energy in PE class?
That doesn't matter. Billy has ADHD. He needs Ritalin. The school psychologist will refer you to a doctor who will give him a prescription for Ritalin. I'm a teacher and I'm very busy.
Billy doesn't need to see a doctor. Billy has been treated by the same pediatrician since he was born. The pediatrician says he's a normal, active, healthy little boy. What makes you so certain that he has ADHD?
Because I'm a busy teacher. I have been a teacher for years. I have tenure. I know when a child has ADHD.
I am aware that some children have authenticated cases of ADHD. Those children need treatment. ADHD is a neurobehavioral developmental disorder. Are you a pediatrician psychiatrist specializing in neurobehavioral disorders?
No. I am a busy teacher. Don't you understand that?
I realize you are quite busy. We all are. Have you ever attended medical school?
No. I am a busy teacher. All teachers are very busy. And we are doing a great job. Opera says so.
Then how do you know that my son or any other child has ADHD?
I'm a teacher. A very busy teacher. That's how I know.
Teachers aren't pediatricians or psychiatrists. What are your other qualifications? Have you ever taken any graduate school level pharmacology classes?
No. I am a teacher. I have a master's degree in elementary education. I'm very busy.
Are you aware of the side effects of Ritalin, also known as methylphenidate? Did you know that Ritalin can impair creative and cognitive processes?
None of that matters. Billy has ADHD. I'm a teacher. I've been a teacher for years. I have tenure. I know when a child has ADHD. The school psychologist will help you make an appointment with a doctor who will say that Billy has ADHD. If you refuse to follow through with my recommendations or the recommendations of the school psychologist, then you must be a negligent parent. I am required by law to report you to Child Protective Services for being a negligent parent. Teachers are the only good parents. All other parents are uneducated hookers and drug addicts who don't care about their children.
I'm not on drugs, but it certainly sounds as if you are.
It's not drugs if a doctor prescribes them. Billy needs Ritalin.
Are you aware that long-term Ritalin use can lead to drug tolerance and psychological dependency? And there is evidence that it can also cause psychiatric problems such as bipolar disorder. Did you know Ritalin has also been known to cause other behavioral disorders including aggressiveness or hostility?
Billy has ADHD. He needs Ritalin. Stop arguing with me. I'm a busy teacher. I know what I'm talking about. Parents don't spend enough time with their children.
What if I were to tell you that Ritalin causes headaches, nervousness, insomnia, stomach ache, nausea, decreased appetite, and heart palpitations? What if I told you that Ritalin is known to inhibit growth? What if I told you that all these negative side effects may never subside or disappear even if the child is weaned off Ritalin? In fact, the side effects can and more often than not result in the child having to be prescribed more powerful pharmaceuticals to counteract the side effects of Ritalin.
None of that matters. Billy has ADHD. He needs medication like Ritalin. I'm very busy. His fidgetiness gets on my nerves.
What did you say?
What? Oh. Parents need to spend more time with their children, then they wouldn't be so fidgety and distracted in class. Yes. That's it.
So let me see if I understand what you are telling me. You believe that my son Billy has ADHD because you are very busy and he is hungry and tired. I don't spend enough time with him and he gets on your nerves. Ritalin will fix all that? Am I following you so far?
Yes. I mean no. I mean to say that teachers are very busy. We're all good teachers. Oprah and Jon Stewart said so. Parents don't spend enough time with their children.
How can you make such a vast generalization about me or any other parent? That sounds like a complete cop-out to me. It sounds as if you are trying to negate your job responsibilities.
I can say whatever I want because I'm a teacher and teachers are always right. We're all doing a wonderful job. Oprah said so on her show many times. Oprah is always right. And the teachers' unions say so too.
Okay. I tried to have an intelligent verbal exchange with you concerning my son. All I am hearing is that you are very busy. I understand that. Most people have very full schedules. However, I don't see how that has anything to do with my son's behavior. He doesn't have a problem at home. His scout leaders have never complained about his behavior. His pediatrician says he's healthy. Could it be that you are not in the right profession?
I have a faculty meeting. I have to leave right now.